A hearty good afternoon and welcome to the session on myths and facts about IVF. We are glad to have Dr. Aradhya among us today to help us understand the topic. She will take us through that and more in this session today. Doctor, you have the stage.
Thanks for your warm welcome. Today I'll be talking about myths and facts about IVF. So, IVF, the first IVF baby was born almost 45 years ago, but there are still a lot of misconceptions about IVF. There are many frequently asked doubts about IVF. One of them most being like, is it painful? Is it harmful to the mother? Is it harmful to the baby? And we even had some questions is it going to make me put on weight? and and I think there's one more question, like, is it going to change the complexion of my skin as well? So I'll be talking about some most commonly asked questions, myths, regarding IVF, and I hope this will help you in clearing any doubts that you have about IVF, and it will help you to take the next step forward if required and go ahead and get IVF done if that is what is required for you. IVF is the only way to have a baby if you are infertile. That is definitely a myth because not everybody has the same issue. Some people just have little hormonal imbalances which can be causing infertility, like high thyroid levels or high prolactin levels or low testosterone levels in men. Treating this simple hormonal imbalances can just help them in getting a pregnancy and may not even require any other treatment. So IVF is the last resort. It is not the first step. So there are many other ways, many other treatments you may need to go before, like your doctor tells you that, yeah, this is not working. You need to go ahead and go for IVF. The first step is usually ovulation induction. In this, we'll just give you medicines for the follicle to grow, and then we keep watching you. It's called as follicular tracking, where we do an ultrasound to see how the follicle is growing. When we see that the follicle is of good size, we give you something called as a trigger. This will help you in ovulating. This is the time when we ask you to have intercourse, because this is the best time for the sperm to go and meet an egg. So this is the first way. So if there are other issues like the count is low for the husband or motility is low, or you have already tried ovulation inductions and didn't work out for you, then the next step would be a IUI, intrauterine insemination. In this, the husband's semen sample is washed and directly put inside the uterine cavity. This will reduce the distance the sperm has to travel and also reduce the time. So even if the motility is less or the count is less, there is more chance of a sperm going and meeting the egg. Then, if none of this work, if there is bilateral tubal block or severe endometriosis or very low count, very low motility or chronic infection in the husband, then the next step will be IVF. So IVF is not the only way; it is the last resort for it as a treatment when you are having infertility. Next one, IVF has a 100% success rate, and IVF can solve infertility issues. So this is definitely a myth, because as any other human built things or human based medicine, like whatever we have done, there is no 100% guarantee for anything. Like I keep telling my patients, if something given by God is not 100% guaranteed, how can something made by humans can give you 100% guarantee? Okay, the success rate of IVF is around 40 to 45% if your age is less than 30. As your age increases, or if your AMH is low, AFC is low, the semen parameters are not good, or if you have other comorbidities like endometriosis or PID, hydrosalpinx, thin endometrium, then the success rate may be even lower. So the next one would be IVF is only for infertile couples. So IVF is usually done when you do have infertility, but it is also done when you have certain genetic conditions in the families which you don't want to carry on to the next generation, like sickle cell anemia, thalassemia, or any other genetic predisposition, genetic conditions which can be carried on to the next generation. Like if you already have a baby who is affected by some diseases, or if you had a baby with Down syndrome or some other conditions like that, in those cases also going for IVF and PGS or PGD can help you in getting a offspring which doesn't have that particular genetic condition. You can do IVF at any age. Yes, we can definitely do IVF at any age, but we have to keep in mind that as a woman's age increases, the number of eggs and the quality of eggs also come down. So the sooner you can plan your pregnancy and try conceiving, and if it doesn't happen naturally, consult a fertility specialist. And if you have tried everything else and it didn't work out for you, there is no point in postponing your IVF treatment, because as your age increases, the success rate also will come down. IVF leads to multiple births. So, according to government guidelines, we are not allowed to transfer more than 3 embryos at a time. This was not followed previously, where at least 4 embryos were being transferred in some patients. But as of now, we can't transfer more than 3 embryos. And single day 5 blastocyst transfer is usually what we prefer to do for a person who is trying to conceive, and this is the very first embryo transfer we are doing. And of course, if the age is also very less, single blast transfer is what we usually advise. There is, even if you are transferring 2 or 3 blastocysts, the chance of it being a multiple pregnancy is only 20%. And even if you are having twins, the chance that one of the pregnancy, one of the sac may not grow compared to the other one, which we call as vanishing twin. So that also can happen in case both the embryos have implanted, and you do see two gestational sacs when we do the first scan. Not all pregnancies will continue being twins. Sometimes they can vanish, which is called as vanishing twin. So when do we want to transfer more embryos? When the age is more, because as the age of the woman increases, the chance of egg being genetically normal, the embryo being genetically normal is low. So we want to put in more embryos because we don't know which embryo is good enough, which embryo has good genetic pool, which can which can implant. Or if you had repeated failures like this, you have already tried 3 or 4 times and you didn't conceive, the next embryo transfer we would usually prefer to put in more embryos. And whenever we are freezing the embryos, or when we are planning like how to freeze the embryos or how to transfer the embryos, we usually have the dialogue with the patient, because some people do prefer to have twins. So usually this decision to transfer how many embryos is done between the doctor, the embryologist, and the patient, keeping in mind their physical conditions, the quality of the embryos, the number of embryos, and what the patient would like to have. Then another myth we usually hear is IVF is never successful at first attempt. As we have been talking about, the success of IVF depends on many factors like woman's age, quality of the eggs, quality of the sperms, quality of the embryos which are subsequently formed after the ICSI, tubal factors like hydrosalpinx, uterine conditions like multiple fibroids, adenomyoma, thin endometrium. All of this also have an impact on the success of the IVF. Usually, when the age is less than 30, 40 to 45% people conceive within the first attempt. 55% conceive in second attempt. 65% conceive in 3 attempts. So even if you have multiple embryos of good quality, you may not have to repeat IVF again. We just keep on transferring more embryos, and once the first embryo transfer is failed, we would like to go back and see if anything else has can be improved. Like if hysteroscopy has not been done for you so far, hysteroscopy is what we look at. To have a look at the uterine lining, we put a camera inside the uterus, go inside the uterus and see if there is any adhesions or subseptum which can be removed and which can improve your chances of success. At the same time, endometrial scratching is done, where we give small nicks with a hysteroscopic scissor at the fundus. This will improve the blood supply to the uterus and also increase the chances of implantation. And one more most commonly asked question is IVF painful? So in IVF, whatever injections we are going to give you are all subcutaneous. It means they are all given with a small needle, which you see when you can see other people in your family, if they're taking any insulin injections, you can notice that the needle is very tiny. So we give the small needle which goes just inside the skin. It's not going to enter the muscle. Just the skin will be pricked. You can even administer these injections on your own. They are definitely not painful. And the only discomfort you would probably face is when your ovaries have increased in size when there are multiple follicles growing. This will present as discomfort in your abdomen, heaviness in your abdomen. There may be little lower appetite during these days, and yeah, once the pickup is done, everything will be normal in almost 24 to 48 hours. And the egg pickup is usually done under short general anesthesia, which is a small procedure. The entire from shifting in to shifting out may take around 30 to 45 minutes. After that, you will be sent home in 3 to 4 hours. This is a daycare procedure. For embryo transfer is a procedure where the embryos are put back inside the uterus. For this, we don't give any anesthesia. If you have ever had an IUI before, this is almost like this. It's almost the same procedure. You can we have many women who are working who come just for their injection, finish their appointment, take the injection, go back to work. They keep working throughout their stimulation cycle, maybe take a leave on the day of their pickup and the day of their embryo transfer. Rest of the time they can keep continuing their daily activities without any issue. And even after embryo transfer, we usually ask them to have bed rest for 2 or 3 days so that they get used to whatever medicines we are giving them, so that they can take rest and be at peace. After that, they can resume their regular activities. IVF requires complete bed rest. Like I was just talking to you about, IVF, we advise bed rest if required only after the embryo transfer. Nowhere else do we advise bed rest. This is asked by almost every couple who come in. We have even had patients who went through IUI or just ovulation induction and ask us about bed rest. Bed rest does not increase your chances of pregnancy. There are multiple studies done in multiple countries, and everybody says the same thing. Taking bed rest will not improve your chances of pregnancy. We only advise bed rest if you are having spotting or bleeding after you conceive, but nowhere during your treatment of IVF or after embryo transfer or after you conceive, we advise bed rest. There is no benefit, and it may even harm you, because lying down continuously is also not good when you're already, if you are already overweight. And some people after embryo transfer also do not want to get up from the stretcher or from the bed and stay like that with their full bladder, which is also not good. Having a full bladder may induce uterine contractions and may do you more harm than good. And the next one is IVF babies are not normal. This is one of the most groundless myths that we hear everywhere. There are like millions of babies who have been born because of IVF in the past 45 years, and there are multiple studies which say that there is no difference between a baby born through natural conception and IVF. The risk of miscarriage is also same when it comes to natural conception and IVF conception. IVF, and when you go for IVF or you go for PGS or PGD because of some issues in the past, like recurrent pregnancy loss, or you already have a baby who is suffering from some condition, going for IVF and PGS or PGD can actually improve your outcome of pregnancy, because we will be screening the genetic abnormalities in the embryos and transferring only the embryo which doesn't have the genetic anomaly. And one more very important myth I want to talk to you today about is, once IVF fails, you can't conceive ever again. So, if a couple has a failed IVF cycle for any reason, this doesn't mean that there is absolutely no hope of any pregnancy. We have been telling you right from the beginning, IVF chance of success is only 40% in the very first attempt. This is because, irrespective of the embryos being normal, when we look at them in the microscope, we don't know what is happening inside the embryos. We don't know what is happening to the genes inside the embryos. Even if they look normal, they can be undiploid. Such embryos may not implant. Even if they implant, they may not grow normally. So once a IVF attempt fails, the next step would be to see what happened and can we modify anything in our treatment approach. Like if a hysteroscopy has not been done, we want to go with that. If the endometrium was not very good, we want to try maybe a cycle of PRP and see if it helps. If there are multiple fibroids, maybe going for a myomectomy may help you in the next cycle of embryo transfer. If there is an adenomyoma or endometriosis, we may have to give you injections to down regulate the uterus, reduce the endometriotic deposits, and then maybe plan embryo transfer. So there are multiple things we can definitely try, because we all know that again, one embryo transfer does not mean it's 100% success. And we have seen many patients who may require 4 5 embryo transfers after which they conceive. So if you have good number of embryos, a first attempt fails, just go to your doctor, talk to them, talk about what else can be done from there. And if you're overweight, maybe losing the weight will help. If you have conditions like diabetes, hypertension, get them in check before you plan your next embryo transfer. Being physically active during, after, before, during, and after your embryo transfer is good. And for some conditions where there is a thick zona pellucida, we may consider doing laser hatching when we go for the next embryo transfer. And one more myth is there are more complications in IVF pregnancy. So what happens is when when the conception is before the age of 30 years, the chance of the pregnancy being usually uneventful is more. As the age of the woman increases, the chances of conceiving naturally comes down, as well as the comorbidities in their pregnancy. Like as the age increases, there's more chance of you being hypothyroid or diabetic or hypertensive in your pregnancy. And once you have all these issues, the chance of it being a more complicated pregnancy is there. So maybe the complications are because of the age and not because of IVF per se. IVF leads to hormonal problems later in life. So, whatever hormone injections we are giving you work for only 24 hours. That is the reason we ask you to take these injections every day till we see that the follicular growth is good. This cannot affect your hormones later on in life. And whatever medicines we are giving you, they are mostly antioxidants which are helpful for your overall health, just not for fertility. Process requires hospitalization. Like I was telling you before, egg pickup is done under short GA, so you'll at most be staying in the hospital for half a day. It's a daycare procedure, and you'll be sent home on the same day. IVF pregnancy means delivery by cesarean section. Natural conception, IUI conception, IVF conception, it doesn't matter. Once you cross 3 months, it is like any other pregnancy. Whatever medicines they are giving you after your third month will depend only on your comorbidities. Like if you have something like a small cervix, short cervix, you may require treatment for that. Like they might have to put a cervical stitch. If you're somebody who is having spotting or bleeding, you may be put on more progesterone hormones even after you cross your third month. And if you develop BP or diabetes in your pregnancy, you may be at risk for preterm delivery. And if your weight is more, again, all of this will play an important role in deciding the way you are being delivered. And the most important of them being the baby's position. If the baby's weight, is your cervix shortening? Are your membranes okay? Or did you have premature rupture of membranes? Is your liquor okay? It doesn't matter in what way you conceive. That type of delivery will only depend on how your pregnancy is progressing. We have seen many people who conceive through IUIs and IVF delivering normally without any complications. So trust your obstetrician, talk to your doctor about your options, and follow whatever your doctor advises. IVF is not an indication for cesarean section. IVF pregnancy needs extra treatment in comparison to natural root pregnancy. So, when we are preparing your endometrium, we usually give estrogen and progesterone hormones. This is called as a HRT therapy. In this is because your follicle is not growing naturally when we are going for a frozen embryo transfer. So, these medicines usually are continued till the placenta takes over, which may take around 10 to 12 weeks. So once the placenta is properly formed, we stop any hormonal medicines from our end. So once you cross third month, IVF pregnancy is like any other pregnancy. Whatever supplements we'll be giving you will be only till the third month. After that, only what is required for your pregnancy will be given. And one more question which we've commonly seen is, can all these hormones we are giving make you put on weight? So, yes, when the ovaries are increasing in size, your hormones are more, estrogen is more, progesterone is more, there will be something called as bloating. If many of you notice, usually your weight is more during your periods compared to what it was before your period started. So in the same way, you may feel that you have put on weight, but that is just bloating because of the increased hormones in your body. All of this will come back to normal once the egg pickup is done. So this is not going to be permanent. The weight gain may be half kg or 1 kg, and this is not even permanent. If you are putting on weight even after the embryo transfer or you conceive, you have to have a look at the physical activity you are having. Don't be on bed rest unless your doctor advises you to have it. Being on bed rest will not improve your chances of conception or your progression of your pregnancy. So just keep that in mind if you feel that you're putting on a lot of weight. Being physically active will even help you in getting a normal delivery once you conceive. So I think I have answered most of the questions regarding IVF conception and IVF pregnancies. If you have any more doubts, please message in the chat section and I'll answer. Thank you.